Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and today we're joined by Dr. Christopher Shelby with WKI Institute. Always a pleasure to have you, Doc.
Yeah, always great to be here.
Yes, okay, and so your colleague, Dr. Coleman, you guys are frequent flyers here on the show, but
of course, he's at Oshkosh right now, you know, the big air show in Wisconsin. So
yeah, because he's a pilot.
He is.
Well.
As a matter of fact, he was a professional aerobatic pilot, air show pilot for a long time, even into medical school. And he has a special airplane called the Wolf Pits that was built specifically for him. And there's only 2 of them in the world. One of them is actually at the Smithsonian Institute, hanging up in the, so if you go to the Air and Space Museum, you'll see one of the Wolf Pits there. But long story short, one of the Australian airshow pilots ended up with his airplane. And so this Australian pilot, who's the best in Australia, ended up coming back to the States because he got the green light to fly in Oshkosh. And so watching Dr. Coleman, he was so excited. He hadn't seen the airplane in 10 years. It was like a reunion. And so he was so excited. The Glenn, I believe his name is, the airshow pilot, came to Coshada, and they did some practice flying in the Wolf Pits, and then they ended up in Oshkosh. So
that's really cool. Yeah, and you guys both have your own separate kind of hobbies too. We
do. Mine are not near that exciting. Yeah.
Yours, correct me if I'm wrong, astronomy, kind of
astronomy,
into
photography, things like that. We do interesting things. So
yeah, well, and photography makes sense because you're also an eye doctor. So I mean, and eyes are very similar to like a camera as well.
Optics, apertures, lenses, focal lengths, all that kind of stuff. So
very cool, awesome. So your primary focus with your practice is cataracts, of course.
That's correct.
The cataractsurgeons.com is kind of what you guys are known for, but pretty interesting that you were in the hot seat recently. You recently had the surgery, and definitely want to talk about your experience today.
Yeah, it was, so about 10 years ago, I'm a little nearsighted with a little bit of astigmatism, and I thought about having LASIK or PRK, and this was maybe 15 years ago. And so one of my colleagues, Dr. Luca, who works with me in Portico, I had him do an exam on me, and he was refracting me, and then he looked at me, he's like, "Oh, you got a cataract." And I was like, "No, I don't. I don't have a cataract." Sure enough, dilated me. We took some pictures, and I looked, and I had this haziness to my lens, my right eye off to the periphery. And what had happened was, when I was about 12 years old, my brother shot me in the eye with a bottle rocket. I know that sounds awful. He didn't mean to, but I still give him grief about it to this day. And of course, it was a traumatic event. I ended up with a high FEMA. It was a pretty significant trauma. And so obviously that cleared up. And ever since then, my pupils have been slightly a different size from each other. But my vision's always been fine, and I've corrected very well. And when Dr. Luca found that, I decided not to do anything because any type of surgery like that would simply make the cataract worse a little bit faster. Well, over the past several years, as I've gotten older, and I'm only 52. I know to you that's much older, but 52 in the cataract surgery realm is not old at all.
Right.
And but over the past few years, I've had more glare at nighttime, and the biggest symptom actually is very interesting. If we're sitting in the kitchen, my wife is sitting in front of like the window, and the light's coming through. It's just a lot of glare. It would just really wash out images, and so that plus the nighttime driving without glare, it was just driving me crazy.
Yeah.
So, and the funny thing is, I've been talking to Dr. Coleman about this for years, and it always is a little nerve-wracking when we operate on friends, family, colleagues. And so, of course, Dr. Coleman, one of the reasons I brought him in with me is because he's such a good surgeon, and somewhat teachable, and so I wasn't gonna let anybody else do it. And when he became comfortable, we talked about it, the symptoms were bad enough. I went through the entire process, the preoperative measurements, the lens selection, which lens am I gonna go with? And then I had it done 1 month ago today. Cool. And I tell you, we truly, even though my vision wasn't horribly bad, it is amazing how much better it is. And like I said, I've always been a little nearsighted with a little bit of astigmatism. My distance vision has never been this good. It is astonishing how much better I see. And it's so good that I'm contemplating doing something with this eye to kind of balance them out.
So, since you've had when you were 12 years old, that trauma, it kind of sped up the process. So the other one isn't nearly as bad.
No. It's kind of a normal lens change as you would see at my age. But what's interesting, even at 52, like when I compare the two eyes, using them together, it's amazing. Using them independently, like with the right eye, everything's very bright. Colors are very real, vivid. They pop out. And with the left eye, there's just a faint, kind of almost yellowish tint. It's not bad, but and like I said, with both eyes together, I don't notice anything. But when I compare the two, there's this subtle difference. It's pretty neat.
Really
and these are things that patients have told me for years.
Right.
And that I told other patients that they're going to experience. But now that I've gone through it, it's like, wow, okay.
You're like, yes, it's
we
real.
weren't lying. Yeah, exactly. I'm not lying to these people. That this is, it's amazing. And the procedure, first of all, the surgery center is amazing. Of course, I guess they considered me a VIP. But I don't think they treated me any differently than they treat any other patient. Right. And so it was, we have an amazing staff, which I've always known that. But being on the patient end of it, they're very reassuring. They're wonderful at starting the IV. Of course, like we were talking about earlier, I got a little sedation. I wanted just enough to not really care, but also not to give away any of the secrets. And I had the lens X laser done, and that was actually very interesting. I tell patients all the time it's going to be like a kaleidoscope of shapes and colors, which it was. And the most uncomfortable part was there's a little suction that happens with the laser, but it's not bad at all. You feel a little bit of pressure when the laser is making all the cuts. It's this swirled kaleidoscope pattern. It's pretty interesting. And then getting underneath the microscope for the surgery itself, you feel a lot of fluid. There's just a lot of water, a lot of irrigation. You're looking at these 3 lights that go between light and black. And my whole goal was to focus on those lights, and I could hear Dr. Coleman talking to me with every step that he was doing. Of course, I knew I was trying not to intervene, and I wasn't trying to give him any direction at all. And it took about 8 to 9 minutes, wasn't long at all.
Wow,
and then immediately afterwards, what's interesting is things are brighter, more colorful. Of course, you're dilated, and I could tell with each step what was going on. Like there was some swelling in the cornea because I could see halos around lights, things like that. I got to put on the post-operative glasses.
So fun. Love it. Yeah, very cool. And the interesting thing is a lot of people think it's something that affects everybody, even the one that is performing the surgery. So it's cool to hear your perspective. Well, Ginger, thanks for joining us. And what is your question today?
Well, hi there. I enjoyed your story so much this morning. I have a question, though. I am scheduled for cataract surgery, and actually Dr. Coleman is going to be doing it. And I had a question. I wake up in the night, and if there is a small night light on anywhere, I can't hardly open my eyelids. Is that something to do with cataracts?
No, ma'am.
Is it, the light?
Yeah, that's probably, your eyes are probably dry. Is it you can't open your eyes because the light's too bright, or?
Yeah, the brightness bothers me.
Yeah,
and even in the middle of the night.
Yeah, how bright is your is that light?
Well, it's like in the hallway, just a night light.
Yeah. So when you're asleep, of course it's pitch black, and so your pupil's really big.
Right.
And then when you wake up like that and open your eyes, of course that light hits you.
It just takes them a few minutes. I don't have any discharge or anything.
Yeah.
It's just the eyelids don't open.
Yeah, part of that's, probably obviously, like I said, your pupils being big dilated, and also your eyes dry out a little bit overnight, so when you wake up, it's almost, a little bit hard. They feel like they're stuck down, and that's more of a dry eye situation. And so a couple things you can do if you don't already, and you can pick up some up today, some artificial tears, like they'll make gel drops that are fairly thick, and put a drop or 2 in before you go to bed. See if that helps.
Okay.
Very helpful.
Just those are over the counter?
Yes, ma'am. Yeah, they're all over the counter. Matter of fact, when you go to the Walmart, Walgreens, or CVS, there'll be this huge aisle with all these eye drops, and so everybody
Right.
gets overwhelmed. All I can tell you is don't get Visine. Get either Systane,
Okay.
Refresh, any of the branded tiers, and they'll say gel. And those are going to be the thicker ones.
Okay.
And before you go to bed, just put some drops in both eyes. And I think that'll actually
Okay,
improve
that
those
sounds
symptoms.
good then. Thank
So-
you. Now I had another question,
Sure.
if I may.
Absolutely.
The cataract surgery itself, I know that there is the laser type of surgery, and is there another one that is not laser? And if I'm a Medicare patient, would I receive the non-laser?
So the laser and the non-laser, there's two steps
Uh-huh.
that the laser does for us that we generally do manually. And one of them is creating the opening to the bag that holds your lens. And the other one is to soften the cataract, so it chops it up like a pizza. And so those two steps we have the laser do for us. The standard way is we do that manually. And depending on the lens that you're getting, one can be a little bit better than the other one. Like the LensX we use when we're really concerned about our predicted outcomes. Like let's say you're getting a toric lens to correct astigmatism or a multifocal lens for distance and near vision. We generally prefer the LensX laser because the size of that opening that we call the capsule rhexis is very important for our predicted outcomes. So now, that being said, the outcome is still very good, regardless of which way you go with it. Are you doing the standard?
I think I'm down for the basic, actually. So just the basic.
Yeah, and you're still going to see very well. And because believe it or not, that's what I ended up with, the basic lens in my right eye for distance.
Okay.
And I opted for the LensX mainly because I wanted to know what that felt like for patients. So.
Sure.
Yeah, you'll do
Well, you're
great.
very kind. Thank you so much.
You're right, and you're in good hands. Like I said, I wouldn't trust anybody else, and I can't operate on myself. So,
Right.
It was
That
nice
would be
what you
interesting.
said about him today, since I am scheduled to be with him.
Yeah, no.
Thank you so much.
Ginger. You're very welcome.
Have a good.
Thanks for the call.
Yeah, thanks for joining us. And we do have another caller. Billy, thanks for joining us. And what's your question?
Hey, Doc, how you doing? I've admired you for a long time. I've seen you on TV quite a bit. How are you doing?
Doing well. How are you? Thank you.
Oh, okay, pretty good. I've only got one eye. I got into a fishing accident in Florida about 10 years back, and I lost an eyeball.
Oh, sorry.
And a hook hit me in the head from a fisherman that was fishing on a boat with me, and it kind of messed me up. But I still got a good eye. And then I was with my girlfriend about 4 months back, and she got mad at me and squirted lighter fluid all over my face, and now I can barely even see out of my other eye. So I've been washing it out real good, but do you have any ideas how I can try to get that eyesight back on my right eye?
How long ago was that?
About 4 months ago.
So have you seen anybody?
No, I haven't. I have a hard time going to a doctor. I mean, I know you're the best, but I usually don't. I usually don't go to doctors at all.
Well, I understand. Hey, look, I don't like going to doctors either. But
I'm sorry, I didn't mean that. But I mean,
no, I know what you're. I know. I'm just joking with you. Having a chemical.
I do a lot of.
A chemical injury like that, of course, it's one of those things where we really have to see it to know exactly what's going on, because the vast majority of the treatments that we do for that are prescription medications or prescription drops, namely steroids. And of course, we can't put a patient on a steroid until we actually take a look.
Right.
And so, keeping it moisturized, of course, with over-the-counter tears, over-the-counter ointments, things like that, can be very helpful. But, of course, when you only have one good eye, like you do, and of course that good eye now is not working very well, that can be very scary. And we would be happy to take a look. Matter of fact, one of our colleagues, who's actually Dr. Coleman's sister, is a cornea specialist, and she would be a great person to take a look at you to see what's going on. Because generally, these are superficial injuries, meaning that the rest of your eye probably works fine. We just need to be able to take a look and see what's going on with your cornea.
Right. Well, the other one, with the salt water and everything, I like to fish a lot. I go offshore, and I work actually offshore. And so now it's gotten to the point where I can't work because I can't even see out of my other eye. So.
Yeah. Well,
so that's kind of messed me up a little bit.
I can imagine, yeah. But I mean, obviously keeping it lubricated is going to be vital. But having us take a look, if you were related to me, I'd say, come on in. Let's take a look at you. Any one of our colleagues would be wonderful to see. But if it's
yes, sir. Okay. Well, then I'll make an appointment and try to get up in there and see you.
Yeah, please do. And when you call, just tell them you talked to me on KTBS, and they'll
sir,
get you in as soon as possible.
Yes, sir. I appreciate you, and thank you for everything that you do for everybody.
All right, Billy. I appreciate it. Thank you.
And if you're just joining us, if you wanted to schedule an appointment, how can someone do that? Maybe with you or Dr. Coleman? Is it easier to do that online?
I mean, they go to thecataractsurgeons.com, and all of our contact information is there. My office number is 212-3937. But all that contact info, and based on where somebody is, we have a clinic at North, off Greenwood Road. We have one at South, off Burt Coons, and then of course another one off Burt Coons at Portico. So no matter where you're located, we have a convenient location.
All right, good deal. Well, Pam, thanks for joining us. And what is your question today?
Oh, this is Pam. Dr. Shelby did my cataract surgery years ago, and now I've got my left eye's giving me some problems. I feel like a film. I use the drops, but it doesn't clear it, and I'm concerned that I may need to have something done to my eye.
Sure.
Now, my appointment is with Dr. Lewis on the 25th. I couldn't get in any earlier, and I'm concerned that that's a whole month away.
With a film like that, has it been coming on slowly, or did it happen all of a sudden?
Well, I've had it on for a good 2 weeks, and it came on slow.
Yeah.
And then I did have pain in that eye. One night I haven't had any.
Yeah, a film like that, the most common thing that happens after cataract surgery is what we call a secondary cataract, which is not a cataract at all. It's just a haziness of that bag that we put the lens in. And of course, when that happens...
Yes, I've heard, yes.
Yeah, and when that happens, it'll feel... Yeah, have you had that YAG laser yet?
No.
Okay, that's probably all you need. And the nice thing is that takes like 1 minute, is completely painless, and you actually notice an improvement in your vision within the hour. It's amazing. Yeah, but that's probably what's going on, especially if you're using drops and it's really not clearing up that haziness.
Yes. Is it okay to wait that long, to the 25th of August?
Yeah, that'll be fine, because that's most likely what it is. Now, that being said, Pam, if you begin to notice over the next week, let's say, that your vision's really deteriorating, it's suddenly getting worse, or you're having pain that's not going away. Having an occasional pain here or there in the eye, it can be fairly common, but if it begins to really hurt or your vision's dropping down noticeably, just come on in.
Okay.
But as long as it's stable.
No, that pain was just, that pain was just the one night.
Yeah. Yeah, that's not uncommon. Like I said, that goes back to like dryness. The eyes get really dry, and it can feel like somebody's sticking you with a needle. Yeah, I know. Yeah, I know. Yeah, that sounds awful, but it can be unpleasant. But it generally doesn't last very long, and it goes away as quickly as it came on. But that haze, I would bet that's what it is. And you should be fine. But like I said, if it seems like it's getting worse, come on in.
Okay. Thank you, Dr. Shelby.
All right, Pam. You're welcome.
Yeah, Pam, thanks for joining us. And we do have a couple minutes left. If you want to give us a call, 318-219-4569. Those phone lines are open. And on the topic of the secondary cataracts, this is something we've talked about a lot on Healthline. Is this pretty common?
Very common.
Yeah.
You know, we say it's about 50% across the board when you look at it statistically. And so, and it can happen at 6 weeks. It can happen at 10 years, you know, but because theoretically the vision should remain completely stable once the cataracts have been taken out, you know, because all my vision change my whole life, and yours too, and everybody else's, is because your God-given lens is changing. And once that comes out and the new lens goes in and it's healed in, like I said, theoretically your vision should remain stable. But we see two things that cause vision change. One is a secondary cataract. That's just that haziness of the bag we put the lens in. And everybody develops a certain type of astigmatism over time. And that has to do with two things, gravity and blinking. And it's actually 0.31 diopters of against the real astigmatism over a decade. And I know it doesn't make a lot of sense, but that's the reason we'll see patients who we did cataract surgery on 20 years ago that now have to wear glasses who weren't in glasses before, you know, so.
Interesting.
But it's nothing that happens overnight, you know,
Right.
except the secondary can, like Pam was saying, can feel like it's happened over a very short amount of time.
Okay.
You know, people use drops, they get glare, and things are hazy, which is why we call them a secondary cataract, because those symptoms tend to come back.
Right.
You know.
Okay. And it's typically you want to intervene because it's kind of that inconvenience. Your vision's not as good as it was, but technically you're okay if you don't end up getting it fixed for whatever reason.
Yeah,
but
I mean,
you probably want to.
Right. Yeah, you'll want to.
Right.
You know, because like, so one thing like with mine, I can guarantee you it's going to happen because I'm younger than the average person having cataract surgery, and so part of that healing is going to create a fibrosis or a haziness of the bag.
Interesting.
Of course, it hadn't happened yet, but I know it'll probably, most likely with me, happen over time, and I won't hesitate to have it done. Which will be interesting again, because if it does, and I know this sounds weird, but I'm hoping it does, so I can kind of see what those symptoms are like,
Right,
you
right.
know, and then going through the process. And I know that the YAG laser takes like just a second, and it is painless, and the results are, I mean, literally patients get up off from the laser and they're like, oh, okay, I can already see better.
That's cool. And with your experience, you said that you started noticing changes how many years ago?
So a few years ago,
Okay.
I began to, you know, I didn't need reading glasses until I was about 49 or
Okay.
50. And it was about then that I noticed, like even with the readers, that my near vision wasn't 100%. And but like I said, it was mainly the glare, like when I was
Right.
driving at nighttime, that became, and I would wear a low power pair of glasses to drive at nighttime, especially in unfamiliar situations. And even with those glasses, the glare with oncoming headlights out of my right eye was just, it was annoying. You know,
Yeah.
it wasn't blinding, but it was annoying me. It's like a rock in your shoe. You know, it doesn't have to be
Right.
very big, but it's just like, oh my God, this is driving me nuts. And like I said, because of our results are so good with cataract surgery, I thought, you know, how long am I going to sit there and let this, you know, fester and drive me crazy, or just go ahead and get it done?
Right, and that's I think what you guys have said time and time again is that you could, you know, keep putting it off and keep putting it off, but if it's bothering you and it's annoying and impacting your daily life, it's probably time to go ahead and schedule that surgery.
Absolutely. You know,
Yeah.
we tell patients all the time, we'll never twist your arm on having surgery. But one of the most common things we hear, especially in our patients who've waited a long
Right.
time to have cataract surgery, is, I wish I'd done this years ago. And of course, I didn't want to be that guy.
Yeah, right.
You know, so.
Okay, so and speaking of, we've talked all about the different types of lenses that you use after the cataract surgery. You know, you take the God-given lens out, put a new one, man-made one in, and you mentioned the Lens X is what you use.
The Lens X
right?
laser. So,
Oh, the Lens X laser. Okay, got it.
and what I opted for was distance vision. This is my dominant eye. It's my shooting eye. And
Okay.
so now, I do not like wearing readers, don't get me wrong, but the reason that we opted for the distance aspheric lens in my right eye was because of trauma. We didn't know how much instability there would be to the bag complex that holds my lens, okay? And so Honestly, at the time of surgery, Coleman was like, it was fine. There was no instability. But when you have trauma like that, you can have a damage to the little zonules that hold your lens bag in central. And so with a multifocal lens, the only thing I was concerned about was if it decentered a little bit, it could cause a little bit of a blur. Whereas the lens I have in now, which is an aspheric lens, if it decenters a little bit, my vision will still be good.
Okay.
And so I knew that going into it. Now, that being said, the LensX laser is the laser that we use to do those certain portions of the procedure that we generally do manually. And it does it reproducibly the same way every time.
Mm-hmm. And that's the new laser, right, that you guys got that only takes how many seconds?
Yeah, it took, effectively, the lasering is like 10 to 12 seconds. It doesn't take long at all.
Wow, okay.
Yeah.
And that's the cool thing about, well, obviously you have this different perspective going into the surgery, knowing all the different lens types, but this is something that you talk about with your patients too. Mm-hmm. Knowing if someone had trauma, you would give them that perspective too of, well, this is what I would probably go with, knowing all of these other XYZ.
Knowing what I know now, and what I'm going to do with this eye is a multifocal, and that's what Coleman and I have been talking about. And I'm going to give him a breather between eyes, But I'm most likely going to go with an extended depth of focus or the multifocal lens in the left eye to give me a range of vision to where I'm not dependent on readers.
Okay.
Because like I said, I can understand, patients are like, hey man, this is great. I love being able to see distance. And these are the ones that had opted just to maximize their distance vision. But they're like, man, my food's blurry,
Oh, wow.
Yeah, and so, like I said, being a little bit nearsighted in my left eye, using both eyes together, I have a range of vision. For small print, I throw on some reading glasses, but I can see my food until I close my left eye. And then it is, it's blurry in that intermediate range. But like I said, the distance, it's crazy. I've never seen this well.
This is so
and
interesting.
Still, every day I'm like, wow, this is amazing. Yeah, it really is cool. I feel like a kid.
I love it. Yeah, especially for you, knowing that this is what you do every day.
I know. It's like, wow,
cool.
we really do have a great job. Yeah.
Was Dr. Coleman, do you ever get nervous performing surgeries now that you've done them so often? And did Coleman get nervous with doing surgery on you?
So, we really rarely, after a number of cases, it becomes routine. And what I mean by routine is like, you're doing the same thing every time. So as long as you don't veer from that and you're ready for any type of situation to happen, you're very comfortable. But there's always in the back of your mind, when you're operating on a colleague or a friend, I recently operated on a friend of mine. And I was not nervous when I did it, but you're always thinking, hey, this is my buddy, and so, but those fears get diffused over time as because I'm thinking to myself the same thing. It's like, I'm operating on my friend, I'm not really nervous because I wouldn't want anybody else to do it, because I know I'm going to take good care of him. And I knew that there was going to be a degree of anxiety that Dr. Coleman may have. Now, he didn't act like it. He was very, very confident, and I knew he would be. I had no doubt, and like I told him, I wasn't going to let anybody else operate on me, and so. But no, nowadays it's what we do.
Yeah. And going back to when you were 12 years old, this trauma that you had to your eye, do you feel like that was maybe in some way that prompted you to take this career field, or was
it
that?
It did to a certain degree because it made me aware of my eyes from that moment on, and there was always a little brightness difference between the two, and that was mainly because, like I said, I had a little anisocoria, which was a slightly larger pupil on this side than this side because of the trauma. And so it always interested me. But it goes back to, like we were talking about, with the physics of photography and optics and things like that, and the fact that we work with Star Wars technology.
Oh, no, it's so cool.
And our patients do so well. We have really happy patients, which was very nice.
Like you said, so rewarding because, almost immediately they see that result and then you're now seeing it too, and you're like, yeah, it is as great as we've been saying.
I know. It's like we'll have patients. I had some last week that they're really nervous. I'm like, look, full transparency. I just had it done. It's the best thing ever. And
cool.
You really, like when I tell you it's painless for me. I knew what was going on. And you're expecting to feel something. You're just expecting to feel this, but it's amazing.
Yeah. 30 seconds left. Tell us where we can find you if we're interested in getting set up with an appointment.
So thecataractsurgeons.com. You can find all of our different locations. My Portico office is 318-212-3937.
All right. Thanks for joining us, Dr. Shelby. Always a pleasure. And thank you for joining us. This will be on our website at ktbs.com/podcast.